You are very welcome to the Royal Jubilee Maternity. We are committed to providing accessible and effective antenatal care, safe labour and birth care, and improved experiences for mothers and babies. You will be given a room in the delivery suite where you will stay during your labour and give birth, and can go home directly from here. There are 2 rooms available with pools in the delivery suite. The pool is filled when you arrive, and after you change you're able to sit on the ledge and use the handles to hold on to, and will be able to stretch out and enter the pool. You will be able to move around in the pool and use the shower attachment. The water temperature is maintained between 36 to 37 degrees centigrade during the first stage of labour, and then to 37.5 for the second stage and the birth of your baby. When your baby is delivered, you will be able to lift and hold your baby and have skin-to-skin contact. At any stage, you can leave the pool with the aid of steps or a hoist. Entonox, also known as gas and air, is the only form of pain relief that can be used in conjunction with the pool. In the room, you will be able to use a settee, rocking chair, birthing mat and birthing ball. The room will be set up according to your birth plan and individual preferences. The gas and air is also available near to the bed, and you will be able to operate this yourself. Oxygen and suction will be available in all rooms, along with a buzzer system for emergencies. The midwife will use a sonicade or Pinard stethoscope to listen to the baby's heartbeat on a regular basis. A cot is available in the room for the baby, as well as a resuscitator, which will only be used if the baby requires extra oxygen support or for paediatric assessment. All babies will have 2 armbands applied, one to a wrist and one to the opposite ankle. These will contain details such as the baby's name, hospital number, mode of delivery and date and time of delivery. If you go home on the day of delivery, measurements of the baby's length and head circumference will be taken and recorded. The plastic clamp applied to the baby's cord at birth will remain on the cord until the cord separates naturally from the baby's tummy. If you are arriving by car, a car park is available directly opposite the maternity hospital. If you arrive in labour, you can get access to the car park at the front of the maternity hospital via the barrier. If you arrive between 10 p.m. and 7 a.m, you will need to use the buzzer system to gain access to the building. If you think you may be in labour, telephone your maternity unit. Please remember to bring your maternity records with you and your overnight hospital bag, which should contain your night clothes and toiletries. When you arrive at hospital, you will be greeted by the midwife. She will assess both your well-being and that of your baby. The midwife will take your temperature, pulse and blood pressure and listen to your baby's heart rate and assess if you are in established labour. Together, you and the midwife will decide what happens next. If you are not in active labour, you may be advised to go home and wait until labour is established. If your pregnancy is normal, the best place to wait is at home. If you are going to be admitted to the delivery suite, you will be encouraged to walk if possible. You and your partner will be accompanied and supported by the midwife. Your birthing partner is encouraged to stay with you and be involved in all aspects of your care. Our delivery rooms are home-like, and most have easy chairs, bean bags and mats, so that you can move about in labour and change position. Some have baths, showers and birthing pools. The admissions midwife will hand your care over to the delivery suite midwife and tell them what's been happening. One-to-one midwifery support will continue during established labour. Your wishes and involvement are essential in decision-making. Your birth plan will be discussed with the midwife so that she knows what kind of labour you want and can help support you achieve it. The midwife will feel your abdomen to check the baby's position and listen to your baby's heart rate throughout the labour and monitor the progress of labour. Usually the baby's heart rate is monitored using a handheld monitor, often called a sonicade. This allows you to be free to move around. If you remain in hospital following the birth, you will be moved to one of the postnatal wards, where we will continue to provide care and support to you and your baby. This would include support with your baby's feeding. When you are ready to go home, the midwife will check and confirm your discharge address so that this information can be given to the community midwifery team, ensuring that you have continued care and support. When you are leaving to go home, you will be given a copy of the book From Birth to 5. This is the follow-on book to your pregnancy book. You will also receive a copy of the Child Health Record, sometimes known as the Red Book. This will have information for the community midwife, who will continue to provide postnatal care to you and your baby. We hope that you have a good experience at the birth and that you and your family enjoy the start of a wonderful life together.